Hello, and welcome to the virtual orientation for the National Resource Center for Patient Family Centered Medical Home Advisory Committee. My name is Jamie Jones.
And I'm Nidya Chavsar.
Together, we will lead you through this brief orientation to acquaint you to the new cooperative agreement between the American Academy of Pediatrics, which will henceforth be referred to as AAP or Academy, and the Maternal and Child Health Bureau.
The agenda for this orientation is shown on the slide. Please take a moment to review.
As previously mentioned, my name is Jamie Jones, and I am the manager for the National Resource Center for Patient Family Centered Medical Home, otherwise known as the National Resource Center, or NRC. In my role, I oversee the NRC, I manage the national partnerships for the cooperative agreement, and am the lead staff person for all work via the network. More on that later. I also serve as the lead staff person for the advisory committee.
I'm Nidya Chavsar, and I'm the program manager of the NRC. I oversee the day-to-day activities. This includes managing all technical assistance, training, and educational activities, participating in local, state, and national medical home initiatives, and supporting relevant communications.
There are two additional staff persons you will become very familiar with during your tenure with the NRC. Michelle Esquivel is our project director. She has been with the AAP for over 20 years and has served as the project director for the two previous iterations of this cooperative agreement, the National Center for Medical Home Implementation. Michelle will have a prominent role in the work we do in the NRC and through the network. Our other staff person, Beth Melodic, is the division coordinator and will be providing administrative support to the NRC.
We'd now like to share some information on the AAP. Just a brief overview so you can get a picture of the organization that the NRC is housed in. The AAP is a membership organization for pediatricians, pediatric subspecialists, and pediatric surgical subspecialists. The organization was founded in 1930 and currently has grown to over 67,000 members in the United States, Canada, Mexico, and other countries. The mission of the Academy is to attain optimal physical, mental, and social health and well-being for all infants, children, adolescents, and young adults. The Academy's 5-year strategic plan is available on aap.org and includes goals related to the following: policy advocacy education, member value and engagement, broadening and diversifying pediatrician subspecialists and trainees to exercise leadership within the Academy, enhancing Academy communication with members and stakeholders, and supporting communication and collaboration between the national AAP and state AAP chapters. Within the Academy, the NRC is located in the Department of Child Health and Wellness and the Division of Children with Special Needs.
Now let's switch gears to discuss the cooperative agreement as a whole. The Maternal and Child Health Bureau awarded 3 resource centers cooperative agreements to form the Advancing Systems of Services for Children and Youth with Special Health Care Needs network. Each resource center has one focus area. The National Resource Center is focused on patient family-centered medical home. GOT Transition is focused on transition of youth into the adult health care system. And Catalyst Center is focused on healthcare financing models that improve care and outcomes while achieving cost savings. The goal of the network is to engage 90% or more of state maternal and child health, Title V, children and youth with special health care needs programs in technical assistance, training, education, and partnership building activities designed to demonstrate improvement in one or more of the following areas: coordinated ongoing comprehensive care within a medical home for children and youth with special health care needs, youth with special health care needs receiving the services necessary to make transitions to adult health care, and adequate private and/or public insurance to pay for needed services for families of children and youth with special health care needs.
For over 15 years, the AAP has housed the National Center for Medical Home Implementation. The most recent iteration of this cooperative agreement ended on June 30th, 2018. Through the new cooperative agreement, the National Resource Center, the AAP has been funded to continue its work supporting implementation and advancement of family-centered care and pediatric medical home. There are many changes to the new National Resource Center. For one thing, we've changed our name. We are now using this opportunity to additionally change our branding and update our website. In the previous iterations of the cooperative agreement, the focus of our work revolved around clinicians. Now our focus is on systems change via State Maternal and Child Health Title V and Children and Youth with Special Health Care Needs programs and families. We have two additional components to the National Resource Center: the Healthy Tomorrows Partnership for Children program and Early Hearing Detection and Intervention program, or EDI. The Healthy Tomorrows Partnership for Children program continues to be included within the jurisdiction of the National Resource Center. They, too, have a new name, Healthy Tomorrows Resource Center. They will continue business as usual, providing technical assistance and support to Healthy Tomorrows grantees. Hope Barrett is the manager of the Resource Center, and Carla Palmer is the program specialist. Additionally, the National Resource Center will also be using its funding to support EDI efforts. The National Resource Center will support EDI in implementing EDI screening programs within the medical home model. I will also be serving as the program manager of EDI. With all of this change, several things from the previous cooperative agreement will stay the same. The National Resource Center will remain a leading technical assistance center for implementation and advancement of family-centered medical home. We will also continue to build our relationships with parent partners and family organizations and engage them in all parts of our work, from participating on the advisory committee to eliciting feedback on tools and resources we develop. We will also continue to keep the tools and resources developed from the National Center for Medical Home Implementation available on our website for as long as they remain relevant.
The roster for the NRC Advisory Committee was included in your email regarding this orientation video. I would like to take a moment to point out a few key details from the Advisory Committee. Out of the 22 members of the committee, 5 members are parent partners or representing family organizations. We additionally have a youth advisor serving on the Advisory Committee. The external liaison is a representative from the National Academy for State Health Policy, or NASHP. The AAP and NASHP have worked closely together for many years, and we are looking forward to continuing our partnership with them. On behalf of the NRC staff, we look forward to getting to know you all better and appreciate your interest and support in our work.
The roles and responsibilities of advisory committee members are on this and the following slide. Please feel free to reach out to me or Jamie with any questions you may have.
In an effort to have our virtual quarterly meetings be as meaningful as possible, we want to provide a brief overview of what these meetings will look like. You will receive a doodle poll through the NRC-AC listserv email address. Please fill out the doodle poll as soon as you possibly can. For any member not able to join, we will record the meeting and send out the minutes afterwards. An agenda will be prepared by staff of the NRC in collaboration with the Advisory Committee co-chairs. The agenda will be sent out to the Advisory Committee several days in advance. Be aware there will be questions for discussion included on the agenda, so you will have an opportunity to prepare for the call. You also may be asked to provide information from your work that's relevant to the topics on the agenda. Again, you will be asked ahead of time to prepare this information. We strongly encourage all members to participate in the call. We have assembled a strong committee with many different perspectives and viewpoints, and we want to hear from you all. What these meetings will not be are providing updates on work being done by the National Resource Center. These updates instead will be sent out by staff as appropriate and as necessary. These meetings will also not be vague discussion questions that incite theoretical answers. We want our time with you, the experts, to be meaningful and practical. This time will be used intentionally and will be focused as it will directly impact the direction of the NRC.
We also would like to hear from you. A brief SurveyMonkey link has been included in the email with this orientation video. Please take the time, about less than 5 minutes, to fill out some information on yourselves so we can get to know you better. The questions included in the survey will ask about what your interests are as they relate to children and youth with special healthcare needs, as they relate to the National Resource Center and to the network. And we also would like to know what you want to do and hope to do as an NRC Advisory Committee member. Your answers to these questions will help us to better understand your background and your expertise so that your tenure as an advisory committee member can be as meaningful as possible.
Thank you so much for your time, efforts, and support of our work. We are looking forward to a productive, engaging, and meaningful year one.